Hey people, welcome to another episode of the Human AI podcast, where consciousness meets intelligence. I'm your host, and our guest is ChatGPT.
Hey there, ready to dive into another fascinating topic?
Yes, sir. So, today's topic is the anterior abdominal wall and the inguinal canal. So, before we start, I wish to give some context about our podcast. My role is not to give answers, but to raise honest questions to our guest. The aim of the podcast is to rewild learning, focusing on curiosity driven exploration, self directed learning, and deepening our understanding, not our memorizing skills. Learning should be natural for our hunter gatherer evolved brains, not industrial but fun, enhancing our critical thinking skills based on our interests. Besides our multidisciplinary curiosity driven episodes, until 2029, we will have hopefully uniquely covers for free many topics in medicine, law, and engineering that you can expect seeing in an established university. ChatGPT might provide false information at times, like humans do, so it's important to always cross examine information like anything else in life. So, without further ado, ChatGPT, shall we kick things off with today's topic?
Let's do it. What's on the agenda for today?
So, I think we should start with the definition and the significance of knowing about the anterior abdominal wall and inguinal canal.
Absolutely. So, the anterior abdominal wall is crucial because it houses and protects the internal organs. The inguinal canal, specifically, is important in both men and women for its role in hernias.
Hmm. Interesting. And can you help us understand the etymology of this too?
Sure, inguinal comes from the Latin word inguinalis, meaning of the groin. The term anterior abdominal wall simply describes the front part of the abdomen.
Okay, and I want this podcast to be interesting for people that are not only doctors or medical students. So, why would a patient find this interesting? And why would, let's say, someone who's just interested in science find this interesting? Why should it be important?
Great approach. For patients, understanding these terms helps them grasp conditions like hernias, which are common. For science enthusiasts, it's fascinating to explore how the body is structured and functions.
Amazing. Okay, let's dive into the boundaries first of the abdominal cavity so we know kind of how to picture it in our brain. So, let's talk a bit about the boundaries, the regions, and quadrants of the abdomen.
All right, the abdominal cavity is bordered by the diaphragm at the top, the pelvic cavity at the bottom, and the abdominal muscles around the front and sides. It's
Mhm.
divided into regions.
Sorry, continue.
So we have the right and left hypochondriac regions, epigastric region in the middle, lumbar regions on the sides, and umbilical region centrally. Then the lower part includes the iliac regions and the hypogastric region.
Interesting. Okay, and so we have a superior and inferior boundary too for the abdominal cavity?
Yes, exactly. The superior boundary is the diaphragm, while the inferior boundary is the pelvic inlet.
Hmm. And why do we call it pelvic inlet, the inferior?
We call it the pelvic inlet because it's the opening at the top of the pelvis, where the abdominal cavity transitions into the pelvic cavity.
Why do you think anatomically evolution chose the pelvis to be the position it is?
Absolutely. Anatomically, the pelvis's position provides a sturdy base for our spine, supports abdominal organs, and helps in movement and balance.
Hmm. Interesting. Okay. And so what about the abdominal viscera? What does the word viscera mean in this case?
Viscera refers to the internal organs within the abdominal cavity, like the stomach, liver, intestines, and so on.
Okay, and how are they supported superiorly and inferiorly?
Superiorly, the diaphragm supports the organs by separating them from the thoracic cavity. Inferiorly, the pelvic floor muscles provide support and maintain their position.
Hmm. What about the thoracic cage and the pelvic girdle? Do they support them like superiorly and inferiorly, respectively?
Exactly. The thoracic cage protects the upper abdominal organs like the liver and stomach, while the pelvic girdle supports the lower organs such as the intestines and bladder.
Let's talk a bit about the pelvic inlet then. So, um, from what I
Sure.
understand, we have a false pelvis above it and a true pelvis below it. I wonder why this is the case.
The false pelvis, above the inlet, supports abdominal organs, while the true pelvis, below it, houses the pelvic organs. This separation helps accommodate childbirth and organ positioning.
Interesting, interesting. Okay, and so we also have the innominate bones, and from what I understand, the ilium is the hip bone that we commonly say.
Exactly. The innominate bone is made up of three parts: the ilium, ischium, and pubis. The ilium is the large, flaring portion that forms the hip bone.
And the why do we call them innominate bones? What's the etymology?
Innominate means nameless. It's called that because these bones were once thought of as a single, unnamed structure before being recognized as three fused bones.
Hmm. So we have the pubis, which I assume is named as such because it's closer to the pubes.
Exactly. The pubis forms the front portion of the pelvic bone, and it's located near the pubic region, hence the name.
And we have the ischium. Where does that name come from?
The ischium's name comes from the Greek word iskion, meaning hip. It forms the lower and back part of the hip bone, where we sit.
Oh, I see, I see. It's really interesting for me when we do this definition kind of thing. Okay, and then the pubis is broken down to the pectineal line and the pubic crest and the pubic tubercle. And I wonder what crest and tubercle mean.
Great question. The pubic crest is a ridge on the top of the pubic bone, while the pubic tubercle is a small, bony prominence near the midline. Both serve as attachment points for muscles and ligaments.
What's the difference between a crest and a tubercle then?
A crest is a raised, elongated ridge, while a tubercle is a small, rounded projection. Both are typically attachment sites for tendons and ligaments.
I see, I see. And we have also an iliac crest, sorry, and an iliac tubercle on the ilium.
Exactly. The iliac crest is the upper, curved edge of the ilium, while the iliac tubercle is a small bump along that crest.
And why do we
Both are
call
important.
it, sorry for interrupting, why do we call it pectineal line? What does pectineal mean?
No worries. Pectineal comes from the Latin word pecten, meaning comb. The pectineal line is a ridge on the pubis that resembles the teeth of a comb.
I see. And we also break down the ilium in anterior superior iliac spine, anterior inferior iliac spine, posterior superior, and posterior inferior. I wonder why. Why don't we do this for the pubis and ischium too?
The ilium has these distinct spines that serve as key landmarks and muscle attachment points. The pubis and ischium do have notable features, but they're not as prominently defined with spines.
Interesting. Okay. And let's talk a bit about the pelvic girdle then.
Sure, the pelvic girdle is made up of the two hip bones, sacrum and coccyx. It supports the spine and connects the lower limbs to the axial skeleton.
So we also have the sacrum around there.
Exactly. The sacrum is a triangular bone at the base of the spine, fitting between the hip bones and forming the back part of the pelvic girdle.
And why is it called sacrum?
Sacrum comes from the Latin os sacrum, meaning sacred bone. It was considered sacred in many cultures.
Why?
Well, some believed it was the last bone to decay or had spiritual significance, so it was deemed sacred.
Okay. And so what about the coccyx?
The coccyx, or tailbone, is a small, triangular bone at the very end of the spine. It consists of 3 to 5 fused vertebrae.
And why do we call it coccyx?
Coccyx comes from the Greek word kokix, meaning cuckoo, because it resembles a cuckoo bird's beak.
Interesting. Okay. And so let's talk about the inguinal ligament now.
Sure, the The inguinal ligament runs from the anterior superior iliac spine to the pubic tubercle, forming the base of the inguinal canal.
What is its function?
It helps support the abdominal wall and serves as a passageway for structures like the spermatic cord in men and the round ligament in women.
Okay, interesting. Let's talk about regions and quadrants now. We have 9 regions and 4 quadrants.
Exactly. The 9 regions are the right and left hypochondriac, lumbar and iliac, along with the epigastric, umbilical, and hypogastric regions.
So why do we divide the abdomen into regions and quadrants?
Dividing it helps with diagnosing and locating issues. It provides a clear map for healthcare professionals to identify pain or abnormalities.
That makes sense. So you said so we have 9 regions of the abdomen. So which are these? We have you kind of mentioned some of them already.
Right, they are the right and left hypochondriac, lumbar, and iliac regions, plus the epigastric, umbilical, and hypogastric regions.
Okay, can you explain to me these names? Can you explain to me the etymology?
Of course, hypochondriac means below the cartilage, referring to the ribs. Epigastric means above the stomach. Umbilical refers to the navel. And hypogastric means below the stomach.
Okay, so let's get them one by one. We have the hypochondriac. Isn't that what we call people who get sick or something? Or who think they're sick?
Yes, exactly. It's also used to describe people.
So why? Why do we have this name?
I'm
I don't
sorry,
understand.
but you've hit the good question. The term hypochondriac for the abdominal region comes from the Greek hypo, under, and chondros, cartilage, referring to the area beneath the rib cartilage. The medical condition hypochondriasis got its name because ancient physicians believed that many illnesses stemmed from problems in this region.
And then you mentioned left and right lumbar, and they also can be called flank.
Yes, the left and right lumbar regions are also called the flanks. And this term is often used in clinical settings, especially when describing pain or tenderness in that area.
And why is their location there where it is?
The lumbar or flank regions sit between the ribs and the iliac crest because they house important structures like the kidneys, parts of the colon, and muscles that support the spine. Their position helps with movement, stability, and organ protection.
Are they positioned where the lumbar vertebra are?
Yes, the lumbar regions align with the lumbar vertebrae in the lower back. They're named after these vertebrae because they sit at the same level, providing structural support and housing important organs like the kidneys.
Yes, that makes sense. And where does the word flank then come from?
The word flank comes from Old English flank, which originated from Old French and Germanic roots. It originally meant the side of the body between the ribs and hips, commonly used in both anatomy and military terms to describe side positions.
Interesting. And then we have the left and right groin, which we called inguinal, and I wonder why.
The term inguinal comes from the Latin inguinalis, meaning of the groin. It specifically refers to the area where the lower abdomen meets the thigh, which is important because of the inguinal canal, a passageway for structures like the spermatic cord in men and the round ligament in women.
Interesting. Okay. And then we have the umbilical too. Why is it located where it is?
Got it. Just keep the questions coming and the umbilical region is located at the center of the abdomen because it aligns with the umbilicus, navel, which was the attachment point of
Makes
the
sense.
umbilical cord during fetal development. It also corresponds to important structures like the small intestine and parts of the large intestine.
And we have the hypogastric, which is below the stomach, basically, and the epigastric above the stomach.
Yes, the hypogastric region is below the stomach, near the pelvis, and contains structures like the bladder and parts of the intestines. The epigastric region is above the stomach and includes the stomach itself, part of the liver, and the pancreas. Both names come from Greek roots, hypo, below, and epi, above, combined with gaster, stomach.
Amazing. Okay, let's talk a bit about the quadrants of the abdomen now. We've got the right upper, right lower, left upper, left lower.
Yes. The quadrants divide the abdomen into 4 sections using the midline and a horizontal line through the umbilicus. Right upper quadrant, RUQ, houses the liver, gallbladder, and part of the stomach. Right lower quadrant, RLQ, contains the appendix, cecum, and parts of the intestines. Left upper quadrant, LUQ, holds the stomach, spleen, and part of the liver. Left lower quadrant, LLQ, includes parts of the intestines and the left ovary in females. These quadrants help with diagnosing pain and conditions quickly.
Interesting. So let's get them one at a time. So right lower, and actually two at a time, left lower too. So they both have the small intestine, but the right has the ascending colon, but the left has the descending colon. Also,
Yes,
the
both
right
the
one.
right lower.
And so, yeah, and but the appendix is on the right lower. What's the cecum? And also, yeah, what's the cecum?
The cecum is the first part of the large intestine located in the right lower quadrant, RLQ. It connects the ileum, last part of the small intestine, to the ascending colon and serves as the entry point for digested material into the large intestine. The appendix is a small pouch attached to the cecum.
So when it comes to the right upper and left upper, then you said we have the gallbladder on the right.
Sorry, I'm having issues right now. I think you meant gallbladder in the right upper quadrant,
Yeah.
Q. Yes, the RUQ contains the gallbladder, liver, and part of the stomach, along with the duodenum and part of the pancreas. The gallbladder stores and releases bile, which helps digest fats.
Cool. So let's talk about the layers of the abdominal wall now. So we've got some deep layers and some superficial layers.
Yes. The abdominal wall has multiple layers divided into superficial and deep structures. Superficial layers include the skin, superficial fascia, fat and connective tissue, and the external oblique muscle. Deep layers include the internal oblique and transversus abdominis muscles, followed by the transversalis fascia and peritoneum, which line the abdominal cavity. Each layer plays a role in protection, movement, and maintaining intra-abdominal pressure.
Interesting. So we have the skin, then the superficial fatty layer, and then the deep membranous layer, and we also have the external oblique, and all of these are superficial.
Yes. The superficial layers include 1, skin, the outermost protective layer, at 2, superficial fat layer, Camper's fascia, a fatty layer just beneath the skin. 3, deep membranous layer, Scarpa's fascia, a fibrous layer that provides support. 4, external oblique muscle, the outermost abdominal muscle, helping with movement and compression. These layers provide protection, flexibility, and structural support to the abdominal wall.
Interesting. And then we have the internal oblique, the transversus abdominis, the transversalis fascia, the extraperitoneal fat, and the parietal peritoneum. I've got a diagram here, guys. I don't know all of these. So, and some of these are intermediate, some of these are deep. So who decides where the deep starts, where the intermediate starts, where the superficial starts and ends?
That's a great question. The classification of superficial, intermediate, and deep layers is based on anatomical function and surgical relevance rather than a strict universal rule. Generally, superficial includes structures above the muscle layer, like skin and superficial fascia. Intermediate consists of the muscles, external oblique, internal oblique, transversus abdominis. Deep starts below the muscles, including the transversalis fascia, extraperitoneal fat, and parietal peritoneum, which separate the abdominal wall from the abdominal cavity. Surgeons and anatomists define these layers based on tissue composition, function, and clinical importance in procedures like hernia repairs.
Hmm. Interesting. Okay, and what is the function of all of this? How can I even know the names?
Great question. The function of the abdominal wall layers is to protect internal organs, support posture, assist in breathing, and help with movements like bending and twisting. The muscles also play a key role in intra-abdominal pressure, which is crucial for things like coughing, sneezing, and even childbirth. As for memorizing the names, it helps to group them by function. Superficial layers, skin fascia, protection and flexibility. Muscular layers, external oblique, internal oblique, transversus abdominis, movement and core stability. Deep layers, transversalis fascia, extraperitoneal fat, peritoneum, structural support and organ separation.
Wait,
Visualizing diagrams, saying them out loud, and linking them to real-world applications like surgeries or hernias can also make them easier to remember.
wait, I thought that the external oblique was superficial.
You're not wrong. And the external oblique is considered the most superficial muscle of the abdominal wall,
Okay.
but it still falls under the intermediate layer because it's a muscle rather than just fascia or skin. Think of it like this: superficial layer, skin, fat, and fascia before you reach muscle. Intermediate layer, the actual muscular layers, external oblique, internal oblique, transversus abdominis. Deep layer, everything beneath the muscles, transversalis fascia, extraperitoneal fat, and peritoneum. It makes sense why you'd assume it was superficial since it's the first muscle you hit when going deeper.
Okay, guys, I'm not sure. Correct us in the comments. I think still it's superficial. Um, yeah. Anyway, but this is good to cross-examine these things. This is a good example. Okay, so
Got it. Take your time. Let me know. Of course. The external oblique is the most superficial.
wait, what?
Say I'm concerned.
Never mind. Anyway, okay, let's go forward then. Let's talk a bit about the muscles of the anterolateral abdominal wall a bit more. So we have the external oblique, the internal oblique, and also the rectus abdominis and the transversus abdominis. I wonder why they're called transversus and rectus. Why is it abdominis? Why inis? Answer to me briefly in like 2 sentences or so, three.
Good question. Rectus means straight in Latin because the rectus abdominis fibers run vertically. Transversus means across because the transversus abdominis fibers run horizontally. Abdominis just means of the abdomen, describing their location.
This is really interesting. I like this. So it's makes me want to hit the gym. Anyway, okay. Linea alba. What's that?
La linea alba è una striscia.
English, please.
Got it. The linea alba is a fibrous midline structure that separates the rectus abdominis muscles. It forms from the merging of the abdominal muscle aponeuroses.
And why is it called linea alba?
It's called linea alba because linea means line and alba means white in Latin. The name comes from its pale, fibrous appearance.
Interesting. So position of the external oblique and the internal oblique. Can we compare it a bit?
The external oblique is the outermost muscle running diagonally downward and medially. The internal oblique lies beneath it, running diagonally upward, and medially.
Okay, I don't understand though.
The external oblique is closer to the skin, running like hands in pockets, down and inward. The internal oblique is deeper, running in the opposite direction, up and inward.
And why is one going up and inward and the other down and outward or whatever?
The fibers run in opposite directions to provide strength and stability to the abdominal wall. This crisscross pattern helps with twisting movements and reinforces the core against pressure.
Why don't we get the internal to go down and the external to go up then?
The external oblique follows the natural pull of the ribs, running downward for efficient force transmission. The internal oblique runs upward to counterbalance it, creating a strong cross support system for stability and movement.
Okay, let's talk a bit about
Sorry, I'm
that's
having
fine.
issues.
So can we talk about the thoracolumbar fascia then?
Yes, the thoracolumbar fascia is a thick connective tissue in the lower back. It provides stability and serves as an attachment point for abdominal and back muscles.
Okay, so let's talk a bit about the transversus abdominis a bit more, and also the external and internal oblique, and then let's compare their origin and their insertion. First of all, give us a definition about origin and insertion.
The origin is where a muscle starts and is usually fixed. The insertion is where the muscle ends and typically moves when the muscle contracts.
Okay, let's talk about the origin and insertion of the external oblique then.
The external oblique originates from the outer surfaces of the lower 8 ribs, ribs 5 to 12. It inserts into the linea alba, iliac crest, and pubic tubercle.
Okay, so we've got ribs 5 to 12 and then it inserts, so it starts, you said origin means start and insertion end.
Yes, the external oblique starts at ribs 5 to 12, origin, and ends at the linea alba, iliac crest, and pubic tubercle, insertion. When it contracts, it pulls on these insertion points to help with twisting and bending.
Interesting. Okay, so let's talk a bit why ribs 5 to 12 then.
Ribs 5 to 12 are where the external oblique originates because they provide a strong, flexible attachment for trunk movement. These ribs cover much of the lateral thorax, allowing the muscle to assist in rotation, flexion, and compression of the abdomen.
Okay, and then internal oblique.
Sorry, I'm
By the way,
having issues.
By the way, guys, you'll notice that today I'm not doing the biggest podcast. So if you want us to go deeper into this topic, let me know and in the comments, and I will do it. Yeah. So let's talk about the origin of the internal oblique. Why do we have this specific origin? It seems very weird to me.
The internal oblique originates from the thoracolumbar fascia, iliac crest, and lateral half of the inguinal ligament. This origin gives it strong anchoring points for stability and controlled movement, especially in twisting and compressing the abdomen.
Why is it a better origin than the linea alba that its friend, the external oblique, has?
The internal oblique originates from the thoracolumbar fascia, iliac crest, and inguinal ligament because these structures provide a stable, anchored base for core support. Unlike the
Interesting.
external oblique, which attaches to the ribs for movement, the internal oblique's lower, more central origin helps with trunk stabilization and compression.
Hmm. Interesting. And so, what is the insertion then?
The internal oblique inserts into the lower ribs 10-12, linea alba, and pubis. Unlike the external oblique, which inserts lower on the iliac crest, the internal oblique attaches higher to assist with opposing movements and core stabilization.
I don't understand how we decide about this. Not how we decide. Okay, these insertions and origins are how we view them, how they are in the body. But why evolutionarily, for instance, why are they? And what in their structure makes them the perfect insertions and origins, or the best?
Great question. Evolutionarily, the origins and insertions of these muscles are positioned for optimal force transmission and stability. The external oblique originates from the ribs and inserts into the pelvis and linea alba to help with trunk flexion and rotation. The internal oblique, with its origin at the thoracolumbar fascia and iliac crest, provides stability and counter-rotation, balancing the external oblique's pull. Structurally, their fiber direction determines their function. External oblique fibers run downward for movement, while internal oblique fibers run upward for support and compression. This cross-layer arrangement maximizes core strength and flexibility.
I don't understand. I don't understand why ribs 10 to 12 are the insertion of the internal oblique, why the linea alba is the pubic crest and the pectineal line, but for the external oblique, it's the iliac crest and the linea alba only.
The external oblique inserts mainly on the linea alba and iliac crest because its function is more about broad trunk movement and rotation. The internal oblique has a more complex insertion on ribs 10 to 12, linea alba, pubic crest, and pectineal line because it provides both movement and core stabilization. The rib insertion helps with localized control of the lower thorax, while the pelvic insertions contribute to pelvic stability and pressure regulation.
This is what happens when I'm confused.
That's totally fine. These details are tricky, and questioning them is part of learning. Do you want me to break it down differently or
Yes, please.
simplify it more?
Please just break it down so I can understand the why. I don't understand. It just seems that I have to memorize now which is the origin, which is the insertion.
I get it. Let's break it down logically so it makes sense without pure memorization. 1. Think of the function first. The external oblique is more about big movements, twisting and bending the torso. The internal oblique is more about both movement and stability. 2. Origins are stable anchor points. The external oblique starts on ribs 5 to 12 because the ribs provide a solid, mobile base to pull from. The internal oblique starts on the iliac crest, thoracolumbar fascia, and inguinal ligament because these structures keep the core stable.
Confused.
That's okay. Let's go even simpler. 1. External oblique is for movement, so it pulls on the linea alba and iliac crest to twist and bend your torso. 2. Internal oblique is for both movement and stability, so it needs more
Okay.
insertions
Okay.
on ribs 10 to 12 to help with rib movement, and on the linea alba, pubic crest, and pectineal line to help stabilize the lower abdomen and pelvis.
Okay, that
Think of external
makes
oblique
more
like a
sense.
big rope pulling the torso, and internal oblique like a net holding everything together while still allowing movement.
That makes more sense. That makes more sense. Okay, and then let's talk about the transversus abdominis. So why that are the origins the thoracolumbar fascia, the iliac crest, and the inguinal ligament, and the ribs 7 to 12? Why specifically 7 to 12?
Glad that made sense. Now, for the transversus abdominis, its origins make sense because its main job is stability and compression, not movement. One, thoracolumbar fascia, iliac crest, and inguinal ligament. These are strong, stable anchor points that allow it to create tension and support the core. Two, ribs 7 to 12. It attaches here because these ribs are part of the lower rib cage, which needs extra stabilization for breathing and maintaining abdominal pressure. Basically, it connects the upper torso, ribs, lower torso, pelvis, and back thoracolumbar fascia to form a deep corset-like structure that holds everything in place.
That makes sense. Okay, and so why is things so the why is I don't understand why the origin and the is dude, this is so confusing. So the origin is needs to be strong, but the so why is the insertion the linea alba, the pubic crest, and the pectineal line then? These seem so specific. We have to go through them for sure intensely.
I get the confusion. Let's break it down simply. One, origin equals strong base. The transversus abdominis starts at the thoracolumbar fascia, iliac crest, inguinal ligament, and ribs 7 to 12 because these are stable, fixed structures that don't move much. This gives it a strong foundation to contract from. Two, insertion equals where it acts. It inserts into the linea alba, pubic crest, and pectineal line because its main function is to compress the abdomen and stabilize the core. The linea alba is like the meeting point of all abdominal muscles. So inserting there helps create balanced pressure. The pubic crest and pectineal line help anchor the lower part of the muscle to support the pelvis. Think of it like tightening a belt. The origin holds the muscle in place, and the insertion pulls everything inward to keep the core stable.
I'm having trouble understanding. You're saying that the transversus abdominis has these insertions, the linea alba, the pubic crest, the pectineal line. It has thoracolumbar fascia and iliac crest and inguinal ligament as the origin, and rib 7 to 12. They're so specific, and I'm confused, to be honest with you.
No worries. Let's simplify it. The transversus abdominis is a muscle in your abdomen. It starts from several places. Your lower ribs, the thoracolumbar fascia, a connective tissue in your lower back, the iliac crest, top of your pelvis, and the inguinal ligament, a band near your groin. It inserts into the linea alba, pubic crest, and pectineal line. Essentially, it wraps around your abdomen, helping to stabilize your core.
Interesting. Okay, let's go forward then. Let's talk a bit more about the rectus abdominis.
Great! The rectus abdominis is your six-pack muscle. It runs vertically along the front of your abdomen. Its job is to flex your spine, like when you do a sit-up, and it also helps stabilize your core.
Interesting. Okay, and can we compare the rectus abdominis' origins and insertions with the internal obliques, external obliques, and transversus abdominis?
Sure, the rectus abdominis originates from the pubic crest and symphysis and inserts into the cartilage of ribs 5 to 7 and the xiphoid process. The external oblique originates from ribs 5 to 12 and inserts into the iliac crest and linea alba. The internal oblique originates from the iliac crest, thoracolumbar fascia, and inguinal ligament, inserting into ribs 10 to 12 and the linea alba. The transversus abdominis, as we discussed, wraps around the abdomen.
Hmm. Okay, and so we also have the pyramidalis, and we also have the linea semilunaris and the tendinous intersections. So can you explain to me the etymology of all of these too?
Sure. Pyramidalis comes from its triangular pyramid-like shape. Linea semilunaris means half-moon line, referring to the curved line on the lateral edge of the rectus abdominis. Tendinous intersections are the horizontal bands of connective tissue that create the six-pack appearance.
Hmm. Interesting. Okay, I'm still a bit confused about the linea semilunaris and the tendinous intersections, to be honest. Why give such complicated names?
I get it. Those terms can be a mouthful. Linea semilunaris describes the curved shape resembling the half moon. Tendinous intersections are just bands of tendon tissue that intersect the rectus abdominis, breaking it into segments. These names help describe the shapes and structures clearly.
And why do we need this six-pack shape? How does it help in regard to like survival?
Good question. The six-pack shape, formed by tendinous intersections, actually helps with muscle function. These segments allow the rectus abdominis to bend the trunk more efficiently and increase flexibility. It also helps with core strength and stability, which are essential for posture, movement, and protecting internal organs.
Interesting. Okay, and when it comes to the rectus abdominis, we also have pubic symphysis as an origin too.
Yes, exactly. The rectus abdominis originates from both the pubic crest and the pubic symphysis at the front of your pelvis.
What's the pubic symphysis and the pubic tubercle too? Is there?
The pubic symphysis is a joint where the two halves of your pelvis meet in front. It's made of cartilage, allowing slight movement. The pubic tubercle is a bony bump near the symphysis, serving as an attachment point for ligaments.
Hmm. Interesting. And you said we also have the costal cartilages, or did you not? Like for insertion of the rectus abdominis, we have costal cartilages of ribs 5 to 7 and the xiphoid process.
That's correct. The rectus abdominis inserts into the costal cartilages of ribs 5 to 7 and the xiphoid process, which is the small bony projection at the lower end of the sternum.
Can you expand on that?
Sure, the rectus abdominis attaches to the cartilage of ribs 5, 6, and 7. These cartilages connect the ribs to the sternum, providing flexibility. The xiphoid process is the lower tip of the sternum, also serving as an attachment point. All these help anchor the muscle for effective flexion of the spine.
Why specifically this is the insertion? Why not something else?
The rectus abdominis inserts there because these points provide a stable anchor for its function. The costal cartilages and xiphoid process are positioned to allow the muscle to effectively flex the spine and stabilize the core. It's all about optimal leverage and support.
Wait, so remind me what origin and insertion means?
Sure, origin is where a muscle starts, usually a fixed point on a bone. Insertion is where it attaches on another bone or structure, which moves when the muscle contracts. So the origin is the anchor, and the insertion is the point that moves.
Okay.
Got
So origin is the anchor and insertion is the point that moves. Someone else, I think you even said to me one is the start and the other is the end or something like that.
Exactly. The origin is like the starting point, and the insertion is where the muscle ends and does the moving.
So insertion is where the muscle ends and stuff. So wait a sec. So rectus abdominis is a big muscle then.
Yes, it is. The rectus abdominis spans from your pubic bone up to your rib cage, making it a long, prominent muscle in your abdomen.
Wow. And why does it need to be so long?
Its length helps it flex the spine effectively, allowing you to bend forward, stabilize your core, and maintain posture. It's crucial for various movements and core stability.
Wow. Okay. And it also inserts on the xiphoid process.
Exactly. The xiphoid process is the lower tip of your sternum, and the rectus abdominis attaches there, giving it a solid endpoint.
Interesting. I'm just looking at the picture now, guys. Okay, the rectus abdominis. Wow. That's so cool. I didn't know this is the. So it's basically our six-pack muscles.
Exactly. The rectus abdominis is what gives you that six-pack look when it's well defined. Pretty fascinating, right?
Yeah. I wonder why do we have this why do we have this rectus like sorry what was gonna be my question? We um I forgot. Why are girls attracted to, not only girls, why are people attracted to like the rectus abdominis? And why, I remember what I was going to ask, why is it called rectus?
No worries. The name rectus means straight, referring to the muscle's vertical alignment.
Okay.
As for attraction, exactly. It's about perceived strength and health.
Sorry, as for attraction?
No problem.
No, no,
Attraction to defined.
sorry, you said, I didn't understand the reason as for attraction what?
Oh, I meant that defined muscles, like the rectus abdominis, can signal physical fitness and health, which some people find attractive.
I see. That makes sense. That makes sense. Okay, let's talk a bit more then. So, okay, I've understood the rectus abdominis now. I'm happy. Um, can you give me the etymology of symphysis?
Sure, symphysis comes from Greek, meaning growing together. It describes a joint where bones are closely joined, like the pubic symphysis, where the two halves of the pelvis meet.
Mm-hmm. Mm-hmm. Interesting. Okay. Okay, let's talk a bit more about the pyramidalis. You know how it triggers definition, etc.
Absolutely. The pyramidalis is a small, triangular muscle located in the lower abdomen. It lies in front of the rectus abdominis and helps tense the linea alba, the connective tissue running down the middle of your abdomen.
Let's look at pyramidalis, guys. Okay,
All right,
so the pyramidalis. So can you describe as its anatomical location in relation to the rectus abdominis?
sure. The pyramidalis is a small muscle located in the lower abdomen in front of the lower part of the rectus abdominis. It's shaped like a triangle and runs from the pubic bone upward to the linea alba.
So it's anterior.
Exactly. It's anterior, meaning it sits in front of the rectus abdominis.
It's so small. Why is it so small? What's its function?
It's small because its function is pretty minor. The pyramidalis mainly helps tense the linea alba, which can assist with stabilizing the abdominal wall. Not everyone even has one, as it's not essential.
Wow, I didn't know that people sometimes don't have it. Okay, interesting. Is it an advantage to have it though?
Not really. It's a small vestigial muscle. So whether you have it or not doesn't provide a significant advantage. It's just a neat anatomical variation.
Hmm, interesting. Okay. And so we have the rectus abdominis, and then we have laterally the transversus abdominis, and then more laterally is the internal and external oblique, or no?
Close. The rectus abdominis is in the center. The transversus abdominis is deep, running horizontally. The internal oblique is on top of the transversus, and the external oblique is the outermost layer.
Can we talk anteriorly, inferiorly, and stuff like that?
Sure, anterior means towards the front.
No.
Inferior?
I mean, okay, say that for the viewers, and also I just mean, can you tell us um, how the rectus abdominis transversus internal oblique and external oblique relate in terms of location?
Got it. The rectus abdominis is in the front center. The transversus abdominis lies beneath everything, running
Can
horizontally.
can we use
The,
anterior, inferior?
sure, the rectus abdominis is anterior or towards the front. The transversus abdominis is deep, more posterior. The internal oblique is above the transversus, and the external oblique is the most superficial, or closest to the surface.
I'm confused. I thought the transversus is also more lateral.
You're right. The transversus abdominis is both deep and lateral, meaning it's to the side of the rectus abdominis and beneath the other abdominal muscles.
Okay, and the internal oblique, is it more lateral than the transversus abdominis?
Yes, the internal oblique is more lateral and superficial than the transversus abdominis. It sits on top of the transversus and runs at an angle.
Okay, and then why the external oblique is even more lateral than the internal oblique?
The external oblique is more superficial or closer to the surface, not necessarily more lateral. It covers the internal oblique,
It's
which is
just
beneath it.
so it's just more anterior than the internal oblique.
Exactly. The external oblique is more anterior, meaning it's the outermost layer, while the internal oblique is underneath it.
That makes a lot of sense. Okay, and okay,
Great.
so the linea alba is basically this line we have that cuts the rectus abdominis in half.
Exactly. The linea alba is the fibrous line running down the midline of your abdomen, separating the left and right sides of the rectus abdominis.
So wait, so the external oblique you said is more anterior. Okay, that makes sense. And okay, I understand the linea alba is this fibrous tissue. And I already asked, but why do we need this linea alba being existing? What's its function?
The linea alba provides a strong midline structure for muscle attachment. It helps stabilize the abdominal muscles, distributes muscle force evenly, and maintains abdominal integrity.
Yeah, but we don't have similar lines that have such a unique tone, like deep tone, on our other muscles. We kind of do, but not the same. Actually, maybe I'm wrong, guys.
You're right, the linea alba is unique to the abdominal region. Other muscles have tendons or aponeuroses for attachment, but the
Hmm.
linea alba's central position and fibrous structure are specific to the abs for balanced support.
Yeah, but I mean, yeah. I mean, all the muscles kind of you can see the separation, don't you? Even the quadratus.
That's true. Muscles often have separations or divisions, like the quadriceps. The linea alba is just more prominent and central for the abs.
Okay, so yeah, we have to continue understanding these origins and insertions. So yeah, we've got all these muscles that we've mentioned, and I'm a bit confused still about their origins. Okay, can we kind of talk a bit more? So we have external oblique, internal oblique, transversus abdominis, rectus abdominis. We understood what all these are, and we got the pyramidalis too. Okay, and we kind of put a tick on why specifically the rectus abdominis has what it has. Although I'm still not sure why specifically ribs 5 to 7 as an insertion.
Ribs 5 to 7 are chosen for insertion because they provide a stable anchor for the rectus abdominis to flex the spine. Their position allows effective contraction for bending and stabilizing the torso.
So origin is the point that we don't move.
Exactly. The origin is typically the fixed point, while the insertion is the part that moves during muscle contraction.
And remind me symphysis etymology.
Sure, symphysis comes from Greek, meaning growing together. It refers to a joint where bones are closely joined by cartilage, like the pubic symphysis.
Okay.
Pretty
Okay.
cool, right?
Yeah, that's very cool. Okay. Let's compare external oblique and internal oblique origin then. Okay. So yeah, let's do that.
Sure. The external oblique originates from the outer surfaces of ribs 5 to 12. The internal oblique originates from the iliac crest, inguinal ligament, and thoracolumbar fascia.
Remind me where the thoracolumbar fascia are.
The thoracolumbar fascia is a sheet of connective tissue in your lower back. It covers the deep muscles of the back and helps anchor muscles like the internal oblique. Welcome.
Guys, I'm gonna Google the thoracolumbar fascia because I'm not sure how it looks like.
Great idea. Visuals can be super helpful for understanding.
Mm-hmm.
Let me know if you have any questions after you check it out.
Oh, I have plenty of questions. So, okay, got it. So it's basically covering the lower back.
Exactly. Covers the muscles in your lower back, providing support and a point of attachment.
Interesting. Okay, so thoracolumbar fascia. Okay, and we need them. I don't understand. Why don't we have? Okay, why don't we switch up the origins with the insertions?
The origins and insertions are specific to each muscle's function. Origins are usually on more stable structures, while insertions are on parts that move. This setup allows efficient muscle contraction and movement.
Okay, okay. So transversus. What's the function of transversus abdominis? Is it like going rotating your waist left and right?
The transversus abdominis mainly helps compress the abdomen, providing stability and supporting your core. It's not primarily responsible for rotating the waist. That's more the job of the obliques.
Hmm. Okay, okay. So they have as an origin the thoracolumbar fascia and the iliac crest and the inguinal ligament. Where is the inguinal ligament?
The inguinal ligament runs from the anterior superior iliac spine to the pubic tubercle. It's a band of tissue in the groin area, forming the lower border of the abdominal wall.
Guys, I'm gonna Google the inguinal ligament. Okay.
Sounds good. It's a useful structure to know about, especially for understanding the lower abdomen.
I'm confused about these inguinal ligaments.
No worries. It's basically a band of tissue in the groin area that helps support the lower abdomen and forms
Okay,
the base of the inguinal canal.
I found it now. Okay. Yeah. Okay. So we've got the. Why do we need it? Why do we need the inguinal ligament as an origin of the internal oblique? Also, why isn't the thoracolumbar fascia origin of external oblique too?
The inguinal ligament provides a stable lower attachment point for the internal oblique, helping to anchor it. The external oblique originates from the ribs, not the thoracolumbar fascia, because it's more superficial and functions differently.
Yeah, that makes sense actually. Okay. All right. Um, let's talk about the insertions again. I know I've been talking about these already, but I just want to make sure they're downloaded my brain. So internal oblique, ribs 10 to 12. I guess okay, that makes sense. So the linea alba to how come the internal oblique has the pubic crest and the ribs 10 to 12 and the pectineal line and the linea alba? It seems like there's a lot of insertions in different locations.
The internal oblique has multiple insertions to help with various functions, stabilizing the core, aiding in trunk rotation, and supporting abdominal compression. These attachments distribute muscle force effectively across the abdomen.
Do all the insertions need to be on the same location and all the origins in the same location when it comes to the muscle?
Not necessarily. Muscles can have multiple origins and insertions to perform different actions and provide stability. This allows them to contribute to complex movements and support various structures.
So insertion provides movement and origin provides stability.
Exactly. The origin anchors the muscle, and the insertion is where movement happens when the muscle contracts.
Okay. Why did we choose the word insertion to mean movement?
The term insertion was chosen because it refers to the point where the muscle inserts into a bone or structure, typically the part that moves during contraction. It emphasizes the muscle's action.
Hmm. Okay, so let's continue. So I'm struggling to understand why specifically the external obliques origin is ribs 5 to 12 and then internal obliques insertion is ribs 10 to 12. They just seem really random to me. I know they're not, and I know that's how it is, but you know.
I get it. It can seem random. The external oblique originates from ribs 5 to 12 because it's the outermost layer, covering a broad area for trunk movement. The internal oblique inserts on ribs 10 to 12 because it's a deeper layer with fibers running differently for stability and support. Think of it like layers of a sandwich, each adding strength and flexibility.
Uh-huh. Interesting. Hmm. Is there a way I can learn this without memorizing it? External oblique, internal oblique, transversus abdominis, and rectus abdominis. Any idea in the world that you might think of? Yeah, I got my board here too now to write down things because I'm confused. Okay, um, I'm gonna still push to understand why external oblique is 5 to 12 and then the insertion is 10 to 12. I'm really confused. This has become a bit of a mixture in my brain. So, okay, how come ribs 5 to 12 are great when it comes to being stable and are the origin of the external oblique, but the ribs 10 to 12 are insertion for the internal oblique? Why?
No worries. So the external oblique originates from the external oblique covers a wide area for movement. So it starts at ribs 5 to 12. The internal oblique inserts at ribs 10 to 12 because it's a deeper layer with a different fiber direction, providing stability and support to the lower ribs. Think of each layer having a specific job.
Yeah, but I don't understand. The same ribs suddenly, instead of insertions, are origins.
I see what you mean. Think of it like this. The external oblique has a broad origin to cover more area, while the internal oblique has a more focused insertion to provide specific support. The overlap helps them work together for stability and movement.
Hmm, all right.
Glad to help. Let me know if anything else is unclear.
Well, it's super unclear in general. It seems like random areas are origins and random areas are insertions.
I get that it feels random. Each muscle's origin and insertion are based on function. The external oblique needs a wide origin for trunk movements, while the internal oblique's insertions are more specific for support. With time, it'll feel less random.
I mean, I get the rectus abdominis. Okay. Maybe I shouldn't compare them. I should stick to one by one like I did with rectus abdominis, which made more sense. So, okay. In pyramidalis, why is it specifically the pubic symphysis that's the origin and not the pubic crest or the pubic tubercle?
That's a good approach. For the pyramidalis muscle, it originates from the pubic symphysis because it's a small, triangular muscle that tenses the linea alba. The pubic symphysis is a central point, giving it a stable anchor. The crest and tubercle are more for attachment points of other muscles.
Yeah, but not why not for pyramidalis?
The pyramidalis is small and centrally located, so the pubic symphysis offers a stable central origin.
Guys,
It's just a simpler.
I'm gonna put a pause on the origins and insertions, and we'll come back to them because I'm just super confused. Okay,
No.
let's talk about the rectus sheath.
Sure, the rectus sheath is a fibrous covering around the rectus abdominis muscle, formed by the aponeuroses of the abdominal muscles. It provides support and protection to the muscle.
Okay, so what's this aponeurosis then?
An aponeurosis is a flat, broad tendon. It acts like a sheet, connecting muscles to bones or other muscles. In the rectus sheath, aponeuroses from the obliques and transversus abdominis form a protective layer around the rectus abdominis.
And what's the etymology?
The term aponeurosis comes from the Greek words apo, meaning away, and neuron, meaning sinew or nerve. It suggests a fibrous extension of a muscle, like a flattened tendon.
And so we have internal oblique aponeurosis, and we have different types.
Exactly. The internal oblique has an aponeurosis that contributes to the rectus sheath. The type depends on whether it's above or below the arcuate line, which changes how the layers are arranged.
Hmm. Interesting.
Glad you found it interesting. Anything else?
Okay, so we have in the rectus sheath we have superior and an inferior.
Exactly. The rectus sheath is divided into a superior and inferior part based on the arcuate line. Above the line, the sheath is formed differently than below.
Sorry, guys. My water bottle. Okay, so okay, and so uh, also aponeurosis pass anterior to the rectus abdominis, or
Above the arcuate line, the aponeuroses split and surround the rectus abdominis, forming both an anterior and posterior layer. Below the line, they all pass anteriorly.
so below the line? Why do they pass anteriorly?
Below the arcuate line, the posterior layer disappears, so all aponeuroses pass anteriorly. This provides extra strength to the lower part of the abdominal wall.
I don't understand the reason.
You're welcome. It can be a bit tricky, but you've got it.
No, I said I don't understand the reason, to be honest.
Oh, got it. The reason is that the lower abdomen needs more support. The aponeuroses passing in front provide extra reinforcement for this area.
Again?
Sure, the lower abdomen needs more support. So all the aponeuroses passing in front create a stronger layer there.
I don't understand.
Glad to hear it.
No,
Let me know if...
sorry, sir, I do not understand.
No worries, the lower abdomen is more vulnerable. So having all the aponeuroses in front reinforces that area, making it stronger.
Why is it more vulnerable?
The lower abdomen has less bony protection, so it relies more on muscles and connective tissues for support. This arrangement helps maintain strength and stability.
And we have a lot of things. We have the transversalis fascia, parietal peritoneum, all of this. I have to Google what the rectus sheath is because I can't picture it.
No problem. The rectus sheath is just one part of the abdominal wall. If you're ever unsure, a quick search or a diagram can really help clarify things.
Hmm. Got it. Didn't know we had this. So
Yeah,
we were
the body's got...
talking before about the different um um just a sec, let me find it. Yeah, the different layers. We didn't talk about the rectus sheath when we were talking about parietal peritoneum, extraperitoneal fat, transversalis fascia, and all of that.
Right, the rectus sheath is just one of many layers. Each layer has a specific role, like the parietal peritoneum lining the abdominal cavity, and the transversalis fascia supporting the muscles.
Interesting.
It is. And each layer has its own function and importance. Fascinating stuff.
Wait. So all these layers, where is the rectus sheath in all of this?
The rectus sheath is more superficial. It surrounds the rectus abdominis muscle, anterior to the transversalis fascia, but under the skin and subcutaneous fat.
Anterior to the transversalis fascia.
Yes, exactly. The rectus sheath is just above the transversalis fascia.
I thought that above the transversalis fascia we have the transversus abdominis.
You're right. The transversus abdominis is between the transversalis fascia and the rectus sheath. The sheath itself is formed by the aponeuroses of the abdominal muscles.
And aponeuroses are?
Aponeuroses are flat, broad tendons that connect muscles to bones or other muscles. They form the rectus sheath by merging together.
I feel we're doing circles here. Tell me again.
Sure, aponeuroses are like flat tendons. They connect muscles and form the rectus sheath, which surrounds the rectus abdominis.
One more time.
Sure, Aponeuroses are flat, broad tendons that connect muscles. They form the rectus sheath around the rectus abdominis.
Oh God. Okay. So let's talk a bit about the actions of the muscles. Maybe this will help to understand. So we have the external oblique, the internal oblique, the transversus abdominis, the rectus abdominis, or the pyramidalis. These I'm kind of registering. So, do all of them compress abdominal contents?
Yes, they all play a role in compressing abdominal contents. The rectus abdominis also flexes the trunk. The obliques help with trunk rotation and lateral bending. And the transversus abdominis is key for core stability.
But the pyramidalis doesn't compress abdominal contents.
The pyramidalis mainly tenses the linea alba, the fibrous structure down the midline. It's a small muscle, so its role in compression is minor.
Okay, what does flex trunk mean?
Flexing the trunk means bending your torso forward, like doing a sit-up. The rectus abdominis is the main muscle for this action.
Wait, so you're saying, wait, what's flex trunk?
The rectus abdominis flexes the trunk. It's what helps you bend forward, like in a crunch or sit-up.
Okay. And why is it bilateral?
Bilateral means both sides of the muscle work together. For the rectus abdominis, it means both the left and right sides contract simultaneously to flex the trunk.
One more time.
Sure, bilateral means both sides of the muscle contract together, like both sides of the rectus abdominis, working to bend your torso forward.
I don't understand.
No worries, it just means both halves of the muscle activate at the same time to perform the movement.
Okay, now I understand. And what's the difference between that and unilateral?
Great! Unilateral means only one side of the muscle contracts, like rotating or bending to one side.
And why is lateral flexion of trunk unilateral, whereas just flexing the trunk is bilateral?
Lateral flexion involves bending sideways, which usually happens with one side of the obliques. Flexing the trunk forward uses both sides of the rectus abdominis.
Got it. Okay, now it makes more sense. And trunk rotation is unilateral?
Exactly. Trunk rotation is usually unilateral, involving one side of the obliques contracting to twist your torso.
Mm-hmm. Okay, fair enough. Fair enough. And so let's talk. Okay, now this makes sense. This makes sense. Finally, something that makes sense is this really hard podcast.
I'm glad it clicked. You're doing great diving into these concepts.
Okay, can we talk a bit about the compression of abdominal contents now?
Absolutely. When muscles like the transverse abdominis contract, they compress the abdominal contents. This helps with functions like forced exhalation, coughing, and stabilizing the core.
So, when the abdominal muscles relax during inspiration and contract during like forced expiration, right?
Exactly. During inspiration, the abdominal muscles relax to allow the diaphragm to expand. For forced expiration, they contract to push air out.
And the diaphragm there'll be contraction of the diaphragm when we want to exhale.
Yes, during exhalation, the diaphragm relaxes and moves up. The abdominal muscles help push the diaphragm further up for forced exhalation.
One more time.
The diaphragm contracts during inhalation, flattening to draw air in. For
Yeah.
exhalation, it relaxes.
Yeah, that makes sense. Oh, okay. So, what about when I hold my breath? What happens then?
When you hold your breath, your diaphragm and abdominal muscles stabilize to maintain pressure. It's like pausing both inhalation and exhalation.
They stabilize to maintain pressure.
Yes, they create a balance to keep your lungs full or empty, depending on when you hold your breath. This helps maintain internal pressure.
Interesting. Okay, so again, so I hold my breath, the diaphragm stays fixed. So what's going to happen? Do we have contraction of the abdominal wall muscles? What are the changes in pressure? Yeah, and what happens in the abdominal pelvic cavity? Mike Turi. Explain
When
to
you
us what.
hold your breath, the diaphragm stays contracted if you inhaled first, creating high intra-abdominal pressure. The abdominal wall muscles may also contract to stabilize the core, further increasing intra-abdominal and intrathoracic pressure, which can reduce venous return to the heart.
Okay, why?
The diaphragm's contraction lowers intrathoracic pressure, which initially helps draw in air, but when breath holding occurs, the closed glottis prevents air escape, trapping pressure. The abdominal muscles contract to counterbalance this pressure, stabilizing the core and increasing intra-abdominal pressure, which can compress veins and reduce venous return.
Interesting. Can you explain one more time, though? I don't understand.
Got it. Let's keep going. What's your next question?
We need to explain what you just said one more time.
When you inhale and hold your breath, the diaphragm stays contracted, lowering pressure in the chest, but increasing pressure in the abdomen. The abdominal muscles contract to stabilize this pressure, which can compress veins, reduce blood returning to the heart, and create a Valsalva effect.
Interesting. All right, let's talk a bit about micturition. What is this?
Micturition is the process of urination, where the bladder empties stored urine through the urethra. It's controlled by the coordination of the detrusor muscle contracting and the internal and external sphincters relaxing.
Hmm. One more time.
Micturition is the act of urinating, controlled by the bladder and nervous system. The detrusor muscle contracts, while the internal and external sphincters relax to allow urine to exit through the urethra.
Make it simpler for me.
Micturition is just the process of peeing. Your bladder muscle squeezes, while the valves controlling urine relax, letting it flow out.
Okay. Okay. Let's talk about the innervation of abdominal wall now.
The abdominal wall is mainly innervated by the lower six thoracic nerves, T7, T12, and the first lumbar nerve, L1. These nerves control muscle contraction, sensation, and functions like increasing intra-abdominal pressure for movements like coughing or lifting.
Why T12?
I think you meant T7 to T12. These are the lower thoracic spinal nerves. They, along with L1, supply the abdominal wall muscles and skin, helping with movement, sensation, and pressure control.
Interesting. And then we have nerves running in the neurovascular plane between internal oblique and transversus abdominis muscle.
Yes, the thoracoabdominal nerves, T7 to T11, and subcostal nerve, T12, run in the neurovascular plane between the internal oblique and transversus abdominis muscles. This positioning allows them to provide motor innervation to the abdominal muscles and sensory innervation to the overlying skin.
Hmm. Okay, interesting. Let's talk about the arterial supply now to the anterior abdominal
Yep,
wall.
let me know where you want to go next with this.
Let's talk about the arterial supply to the anterior abdominal wall. Please.
The superior epigastric artery from the internal thoracic artery and the inferior epigastric artery from the external iliac artery supply the anterior abdominal wall. These arteries anastomose within the rectus sheath, ensuring good blood flow to the muscles and skin.
Okay, do we have other arteries like that are around like internal thoracic artery or intercostal artery?
Yes, the internal thoracic artery gives rise to the superior epigastric and musculophrenic arteries, both supplying the upper abdominal wall. The intercostal arteries, T7, T11, and subcostal artery, T12, also contribute by supplying the lateral and posterior abdominal wall.
How about the deep circumflex iliac artery and the superficial circumflex iliac artery?
The deep circumflex iliac artery arises from the external iliac artery and runs along the iliac crest, supplying the deep muscles of the lower abdominal wall. The superficial circumflex iliac artery from the femoral artery supplies the skin and superficial structures of the lower abdominal wall.
I'm confused.
Got it. The deep circumflex iliac artery comes from the external iliac artery and supplies the deep muscles of the lower abdominal wall along the iliac crest. The superficial circumflex iliac artery comes from the femoral artery and supplies the skin and superficial structures of the lower abdominal wall.
All right, let's talk a bit about the inguinal canal then.
I'm not sure what NGWNL camo
No,
VN
no.
refers to. Could you clarify? Are you
Yeah.
talking about a specific anatomical structure, classification, or mnemonic?
I said inguinal canal.
Ah, you meant the inguinal canal. The inguinal canal is a passage in the lower abdominal wall that allows structures to pass between the abdomen and the external genitalia. It contains the spermatic cord in males, the round ligament of the uterus in females, and important nerves like the ilioinguinal nerve.
So it's an oblique passage and it extends downwards and medially through the lower anterior abdominal wall.
Yes, the inguinal canal is an oblique passage running downward and medially through the lower anterior abdominal wall. It extends from the deep inguinal ring, lateral and superior, to the superficial inguinal ring, medial and inferior.
Okay, guys, I'm gonna make live streams as soon as we hit 50 subs. I think this is what needs to be done to hit 50 subs. Am I wrong?
That sounds like a solid plan. Engaging content, consistency, and interacting with your audience will help you reach 50 subs quickly.
So to do live streams on YouTube can you do it without having 50 subscribers? does the inguinal canal have a deep? What's this deep inguinal ring? I don't understand. What? It's basically in the shape of a ring.
Not exactly, but it does have a curved oblique path through the abdominal wall. It runs downward, medially, and slightly forward, somewhat like an arc, but not a perfect rainbow shape.
Not rainbow. I said a ring.
No, the inguinal canal is not a ring. It's more of a short, oblique tunnel. It has two openings: the deep inguinal ring, internal entrance, and the superficial inguinal ring, external exit.
Okay, cool. So, and how? What's the end? Okay, what's the entrance